terhadap percakapan lain. Preeti madam, you can share your screen, madam.
Yes, sir.
Whether the speaker joined, madam?
Yes, sir. Join, sir. Sabira, madam, can we start the program? Yes. Preeti, madam, you can start, madam.
Okay, sir. A very good afternoon to all of you. Welcome to the national webinar on PCOD lifestyle modification and menstruation hygiene on the occasion of Sexual and Reproductive Health Awareness Day. So today we have with us Dr. S.K. Sabira and Dr. M. Stravani from Femicare Hospitals, Hyderabad. We are very glad to have you with us today. This program has been organized to create awareness among students on the basis of sexual and reproductive health. And through this webinar, Dr. Sabira and Dr. Stravani are going to walk us through this process and awareness. So before starting the webinar, we would like to have a few instructions for the participant. Always mute your microphone so that there is no disturbance. Keep your videos off. If you want to post any clarify any queries, there is an interactive session at the end. So you can, during the interactive session, you can raise your hand or post your queries in the chat box. So, I would like to give a brief introduction about MNR Education Trust and MNR College of Pharmacy. MNR College of Pharmacy is one among the top 73 institutions of MNR Educational Trust. The MNR Educational Trust was established in 1974 by Sri M.N. Raju with the noble aim to shape the students into proud citizens of the country. Sri Ravi Varma Mantena, the dynamic vice chairman, adds a perfect blend of modern approaches to achieve this goal. About MNR College of Pharmacy, it was established in the year 2004 and it is up by AICT and PCI and affiliated to the Osmania University. The courses offered in this college are B.Pharm, PharmD, PharmD PB, and M.Pharm. The college is equipped with laboratories with necessary equipments and instrumentations to successfully carry out the courses offered. The library is facilitated with more than 1,000 volumes of specialized books, journals, and digital library facility. The college also encourages co-curricular activities for the students and cultural and sports activities. And our college is very proud to have our principal, sir. We are working under the guidance of Principal Dr. V. Alagarsamy, sir, who is an eminent personality in the teaching field as well as in the research area. Dr. Alagarsamy, sir, has been awarded, ranked as in the top 2% scientist in the world by Stanford University, and his credentials have been an inspiration to all the students and faculty in our college. The college provides special initiatives for supporting the students and training the students for the university ranks and for exams like GPAT, NIPER, such competitive exams, and also provides placement and career counseling, personality development for the students. And also going by the words of our chairman, sir, Sri M.N. Raju Garu, education without discipline is of no use. The college is always very systematic and disciplined about its students and all the activities in the college. Now I request our principal, sir, Dr. V. Alagarsamy, sir, to give the welcome speech and start the session. Sir, please.
Thank you, madam. So on behalf of the chairman, our Sri M.N. Raju Garu, and our vice chairman, Sri Ravi Verma Garu, I welcome all the participants and especially the today's resource persons, Dr. Sabera and Dr. Stravani, for accepting our invitation and sharing their experiences. It is fortunate to have in this occasion, madam.
It's a pleasure, sir. Thank you.
Hope our students will be enlightened very well. And this is a good occasion that especially our pharma graduate students who will be learning from you, and we will be extending to our students as well as to the community will be rendering these services. So on behalf of institution, we welcome the today's speakers and hope we'll have a great session ahead. Thank you. With these few words, I request Dr. Raviteja to introduce the today's speaker. Thank you.
Moving right along, good afternoon to everyone. It's my pleasure to introduce our guest speaker, Dr. S.K. Sabera. Dr. S.K. Sabera, Bachelor of Medicine. He did her Bachelor of Medicine and Bachelor of Surgery from Alluri Sitaramaraju Academy of Medical Sciences, Elur. And also post-graduation diploma in obstetrics and gynecology from Rangaraya Medical College, Kakinada. Presently, Madam is pursuing her DNP at Femicare Hospitals, Hyderabad. And Madam awarded a gold medal at Dr. E.N.B. Sharma Memorial Exam in Department of Surgery 2015. And also received a gold medal in obstetrics and gynecology diploma from Kakinada OBG Society in 2019. Submitted her thesis on correlation of endometrial thickness with histoplasmic examinations in women with postmenopausal bleeding. And now with this, in this session, we are going to have a talk on polycystic ovarian disease and a few of the lifestyle modifications. With this brief introduction, I graciously invite Dr. Sabera Madam to share her thoughts. Please, Madam.
Thank you. Thank you so much for your kind introduction. Shall I share my screen?
Okay, madam.
So polycystic ovarian disease. Today is Sexual and Reproductive Health Awareness Day. Why we are talking about polycystic ovarian disease? Because it is the most common problem nowadays all the adolescents are facing, as it is the main cause of infertility in nowadays. So what is polycystic ovarian disease? Why is it causing infertility and how can we prevent it? Is the today's session. This is the outline of my presentation today, which includes introduction, etiology, pathophysiology, clinical features, differential diagnosis of PCOD, investigations we should do, treatment, complications, etc. Now coming to polycystic ovarian disease, what is it actually? It is a condition in which ovaries produce many immature or partially mature eggs, which happen due to poor lifestyle, obesity, stress, and hormonal imbalance. The severe form is known as polycystic ovary syndrome, where it is a heterogeneous disorder that is defined by a combination of signs and symptoms of androgen excess and ovarian dysfunction, with the clinical manifestations of oligomenorrhea, subfertility, hirsutism, and acne. So it was first described by Steen and Leventhal in 1935. So it is also called as Steen and Leventhal syndrome. The incidence is about 5 to 10%, and it is a leading cause of female infertility. It is related to the insulin resistance described later by Bergen in 1980. So first of all, let us know about the female reproductive system, which consists of uterus, cervix, and vagina, with tubes and ovaries. To get a proper menstruation, we have to have normal ovaries, normally functioning ovaries with patent tubes and a normally functioning and uterine endometrium. So what happens in these ovaries? Ovaries will have multiple follicles which will be growing, and it will be converting into many stages like primordial follicles, primary follicles, secondary follicles, and later tertiary and Graafian follicles. The mature follicles will get ruptured, and in every cycle one follicle gets ruptured and it releases the ovum. This is known as ovulation. So this ovum will be taken up by the fallopian tubes. It is transported into the tubes, and where if the fertilization happens by a male sperm, it leads to implantation in the uterine cavity. If there is no fertilization, this ovum gets released in outside. Then what is happening to the remaining follicle after the ovulation? It is forming a corpus luteum from where hormones are released, progesterone is released, which is necessary for the menstruation. So this is the normal functioning mechanism. So this normal functioning is altered and it is becoming abnormal in this polycystic ovarian disease, where the follicles are multiple and immature and there is no ovulation. So there is no proper menstruation, and the persons will get infertility. So during menstrual cycle, we have to have a good mechanisms there, where the hypothalamus releases the gonadotropin releasing hormone, which acts on the anterior pituitary, which releases the gonadotrophins, those are follicle stimulating hormone and luteinizing hormone. These follicle stimulating hormone and luteinizing hormone acts on the ovary. So from this ovary, the hormones estrogen and progesterone are released. These acts over the uterus. This entire mechanism and entire organs should be proper for the normal functioning of normal menstrual cycle. So this is a complex image which is easy to understand. So normally our days of cycle, normal menstrual cycle consists of 28 days, wherein the first few days there will have menstruation, and later the endometrium keeps growing. So in this process, in this Ovarian histology include the follicles starts growing from the first day of menstrual cycle. And at the 12th to 14th day of a normal menstrual cycle, the ovulation occurs. These follicles contains granulosa cells, which releases the estrogen hormone. This blue line is the estrogen hormone, which will be increased just before the ovulation. And the luteinizing hormone is stimulated, which is released from the pituitary. And so after this luteinizing hormone peaks off, this ovulation occurs. And so to have a proper ovulation, first of all, we have to estrogen should be normal, and we should have a growing mature follicle. So after this ovulation, the corpus luteum forms. This corpus luteum starts releasing progesterone. So we can see the other half of the cycle, there is elevated progesterone levels, whereas in the first cycle, there is low progesterones, and the other half contains more of progesterone. This progesterone helps in the secretory phase, that is luteal phase, which helps in the maintenance of the endometrium that is formed. So as there is no implantation, as there is no fertilization, this corpus luteum degrades and degenerates to form corpus albicans. So as the corpus albicans is formed and no longer the progesterone is released, and the estrogen also decreases, as both the hormones are decreased, the endometrium here gets sheds off, and this causes menstruation. So normally, ovary consists of follicles. In these follicles, granulosa cells and theca cells will be there. This luteinizing hormone acts on the theca cells, which releases the androgens, that is testosterone, dehydroepiandrosterone sulfate, etc. So these androgens are formed from the cholesterol in our body. So these androgens are taken up by granulosa cells, wherein the androgens are converted by aromatase enzyme into estradiol. So this happens in the normal cycle. The cholesterol is converted into androgens, and these androgens are converted into estradiol. Whereas in the polycystic ovary disease, and whereas in obese women, there will be insulin resistance. Due to this increase in adipose tissue, increase in cholesterol, this cholesterol releases pro-inflammatory mediators, and which causes insulin resistance at the level of tissues. So insulin will not be taken by tissues, resistance will be there. To overcome the resistance, pancreas will be releasing more insulin, and insulin like growth factor 1 is increased. All these causes increase pressure over the theca cells to produce more androgens from the cholesterol. So in this, more androgens are released and estradiol levels are decreased, and the polycystic ovary hirsutism and all will be occurring. Hirsutism means abnormal facial hair as a male pattern. So this is the mechanism. So etiology includes, it can be idiopathic, genetic basis may be there with the dysregulation of cytochrome P11A gene, upregulation of other enzymes in androgen synthesis pathway, decreased sex hormone binding globulin, family history of polycystic ovarian syndrome, insulin resistance, obesity, and drugs like valproate. So these genetical causes and this lifestyle and obesity, all these causes hormonal changes. These hormonal changes which causes increased androgens, these androgens causes hirsutism and acne. And due to these hormonal changes, insulin levels are also increased. These will cause ovarian follicle anovulation, and as there is no ovulation, menstrual disturbances will be there. And this insulin resistance may in future causes diabetes, cardiovascular risk, and metabolic syndrome. All this leads to psychosocial issues, body image is disturbed, self-esteem is lost, depression, anxiety. These are the clinical features of PCOS. Those are hyperandrogenism with hirsutism, acne, androgenic alopecia, that is loss of scalp hair, menstrual irregularities, which include oligomenorrhea in 70 to 75%, amenorrhea in 20%, infertility in 30 to 70%. As we all know, oligomenorrhea means bleeding more than 35 days. Every cycle occurs more than 35-day delay. Amenorrhea, absence of menstruation, and infertility. Then obesity. Insulin resistance causes acanthosis nigricans, that is skin pigmentation over the areas mostly on the nape of the neck. Then abnormal skin tags, impaired glucose tolerance, and in future type 2 diabetes mellitus. So this picture shows the 10 signs and symptoms of polycystic ovarian syndrome, which include acne, weight gain, depression, stress, high blood pressures, excessive facial and body hair, absence of menstruation, irregular periods, hair thinning and loss, abnormal skin discoloration. So what is the diagnostic criteria of polycystic ovarian syndrome? This Escherick 2003, it described the confirmation of PCOS if we have 2 out of these 3 symptoms. So first one is the oligoanovulation, which is experienced by irregular cycles or absence of cycles. Second one is clinical or biochemical signs of hyperandrogenism, which is described by hirsutism, acne clinically, biochemically by certain tests, which I'll say later. Polycystic ovaries on ultrasound. Out of these 3 features, if the individual contains any 2, we can diagnose her into PCOD. So before diagnosing a patient with irregular cycles as PCOD, we have to evaluate other causes also, like hyperthyroidism, hypothyroidism, hyperprolactinemia, hypogonadotrophic hypogonadism, primary ovarian failure, acromegaly, late onset CAH. These are all rare, congenital adrenal hyperplasia, and ovarian adrenal tumors, Cushing syndrome, and others. So what are the investigations we will do? Those are FSH and LH, which are the gonadotrophins I described before, which are released from the pituitary for a normal ovulation. Then as the testosterone levels are increased, androgens are increased, testosterone levels should be done. Other to exclude other causes, thyroid function test, serum prolactin, and to get the impaired glucose tolerance test, we have to do 2-hour glucose tolerance test, fasting insulin level, lipid profile, DHEAS, 17-alpha hydroxyprogesterone, and cortisol. Radiological tests include ultrasound scan, which shows us a polycystic ovary, an ovary with multiple cysts. These cysts are nothing but immature follicles. Histology is rarely done to distinguish between the ovulatory cycle or anovulatory cycle. The complications of PCOS, if left untreated, future they are prone for type 2 diabetes due to impaired glucose tolerance. This cholesterol may cause metabolic syndrome, which include hypertension, diabetes, obesity, cardiovascular diseases. And this PCOD can lead to endometrial cancer because of unopposed estrogen, which is there. It causes endometrial hyperplasia. It is the rarest one to cause endometrial cancer. So coming to the management include non-pharmacological, pharmacological, and surgical. Most of the PCOD can be treated by non-pharmacological measures itself, by lifestyle modification. So what are the non-pharmacological? We have to change our lifestyle. We have to get away from the sedentary lifestyle which we are habituated now. So weight loss is the most important one. Exercise should be done, physiotherapy and all. So good diet, good nutrition, which contains balanced diet, all should be included. So lifestyle measures, this is advocated as initial management. and as an adjuvant with any other modality. What should be our diet? Achievable goals such as 5% to 10% weight loss in those with excess weight yields significant clinical improvement. Even if the person loses 5 to 10% of her weight, she can have a great clinical improvement. Overweight and obese individuals should take an energy deficit of 30%. They should reduce their calories to they should reduce their calories by 30% of their diet from their diet. Consider food preferences, avoid unduly restrictive and nutritionally unbalanced diets, reduce carbohydrate to only 40% of total calories. The diet should be divided into 3 main meals and 3 snacks. Avoid refined carbohydrates and sugars in processed foods. Increased fiber content in diet by increasing fruits and vegetables, oat bran and barley. Increase of intake of omega-3 or 6 fatty acids, fish, nut, olive oil. Never skip breakfast or meals. Eat breakfast within 2 hours of waking up. Pharmacotherapy. If the lifestyle modifications cannot reduce your PCOD, cannot reduce your clinical manifestations, we have to go for pharmacotherapy. And for the treatment of irregular cycles and hirsutism, we have to prescribe the combined OC pills. These are the hormonal pills with both estrogen and progesterones. So we have to give for them for 3 to 6 cycles to regularize the cycles. Then anti-androgens, if the hirsutism is more and cannot be relieved by this COCs and by metformin, which will be described later. These anti-androgens, some of them are spironolactone, cyproterone acetate, flutamide, finasteride. And we have to wait for at least 6 months for the response if the anti-androgens are given. And if the anti-androgens are given, we have to give combined contraceptive pills also, advice for contraception also. So for the treatment of insulin resistance, metformin is prescribed. This metformin is generally prescribed in PCOS patients to all infertile women if the BMI is greater than 25 milligram per meter square. And if the combined OC pills and lifestyle measures do not achieve the desired goals. Then myo-inositol is a naturally existing carbohydrate compound. It is available as diet supplement and plays a role in insulin signaling, thereby increasing insulin sensitivity. This is also used nowadays. Obesity should be considered if lifestyle measures, insulin sensitizers, all are failed, then only the medication is given, rarely given for obesity. Surgical treatment is laparoscopic ovarian drilling, where the polycystic ovaries are cauterized by laparoscopy. And the cystic fluid which is there in the ovaries should be released. The conclusion of my topic today is women with BMI of 30 or over must lose their weight. This alone can restore their ovulation, improve their response to ovulation induction agents, and have a positive impact on pregnancy outcome. 50% treatment of PCOS is simply weight control. Even if one loses 5 to 10 kg, the effect will be tremendous. Early diagnosis and treatment helps prevent long-term complications such as infertility, metabolic syndrome, obesity, diabetes, and heart disease. Thank you so much.
Thank you, ma'am. Thank you for the very informative session. Ma'am, now can you stop sharing the screen so that we can have an interactive session? Okay, thank you, ma'am, for walking us through the pathophysiology, clinical features, the diagnosis, and the treatment. It was a very informative session.
Thank you.
Now, can we take up some questions if any queries from the participants?
Yes.
Okay, now the session is open for queries. You can post your queries in the chat box. Otherwise, you please raise your hand and we'll unmute you to convey your queries to the speaker. Ma'am, we have one question where this. If there is the question from the students is if the PCOD, if PCOD by any irregularities in the menstrual cycle, or can the person have PCOD?
Can you please repeat?
Always is PCOD always associated with irregularities in menstrual cycle? Or even if the menstrual cycle is fine, does it mean that there will be any PCOD? Should we suspect any PCOD?
Yeah, in normal menstruating women also, in 25%, in 20% of women who are normal menstruating also can have PCOD. So always PCOD will not cause irregular cycles.
Irregular cycles will be always present. So is the one more question which we have from the students is like rapid weight gain. If person is having rapid weight gain, does it always mean it is PCOD, or should they suspect any other?
No, PCOD comes after the weight gain. PCOD will not cause weight gain. In future, it may cause, but the PCOD itself is caused due to weight gain. The person who with rapid weight gain may be diagnosed as PCOD later.
Okay. So is there any, we have one more question here, which is regarding whether what is a diet plan we can follow for if we are having PCOD?
So as I have said, we have to prepare a proper diet plan with 3 major meals and 3 snacks. Actually, the snack should not contain pizza or burgers like that. It should contain a fruit, a salad, like a vegetable salad, and so. And that diet which we are taking in the major meals should not be like biryani and all. Should be like limited one. The breakfast, the lunch, and the dinner should be minimized. They should cut off their diet which they are taking. They should decrease by 30%. What all they are eating before, they should decrease their calories in that from that 30%.
Okay.
So their diet should include omega-3, omega-6 fatty acid rich like fish, fish oil, fish nuts, like that. And they should eat more of dry fruits and all.
Where regarding like, can you elaborate on the clinical symptoms for PCOD again?
Yeah. So the clinical symptoms, as we told, there will be irregularities in menstruation. First one, because there is no ovulation. Normally the PCOD ovary is not ovulating and will not have normal menstruation, which will be occurring only if the proper ovulation occurs and proper corpus luteum is functioning. So as we don't have ovulation, we are not having a proper menstruation. Menstrual irregularities will be there, which include amenorrhea, oligomenorrhea, etc. And then hirsutism, that is presence of abnormal facial hair and all, that is acne and all. So this is caused due to hyperandrogenism. Ovary also produces androgens in the normal woman too, but this production is increased in the PCOD ovary. So the abnormal hair and all are symptoms. And then the other one is the insulin resistance, which is caused by obesity. And this causes acanthosis nigricans, that is pigmentation over the nape of the neck, hyperpigmentation over the nape of the neck. It is due to the thickening of the basal layer of the epithelium by insulin resistance. So these are the main symptoms.
Yes, thank you, ma'am. Ma'am, we have one more question from a student. What is the best treatment we can adopt for the PCOD problem?
Best treatment, there will be no, normally the best treatment is if the patient is having more weight, more obesity, she is obese, then we have to advise her to reduce her weight. First of all, her BMI, what is called body mass index, should be less than 25 always. And if she has more weight, we should ask her to reduce her weight at least by 10 kgs, 5 to 10 kgs, so that 50% of the women will be having normal cycles if they reduce the weight. First treatment is obese women is to reduce the weight.
Thank you, ma'am. Ma'am, one more question here. If the person is having hypertension and PCOD, then what is the lifestyle modification and treatment alternatives?
Hypertension will be caused in PCOD in future. If the person will have both, then the hypertension should be treated as it is by the physician, and the PCOD should be, as we told, like lifestyle modifications, the treatment pills which we told, metformin or combined OC pills, what is according to the need of the patient, like infertility, what is the need of the patient, what are the clinical symptoms, we have to treat accordingly to PCOD.
Ma'am, there is one more question. Is thyroid problem related to PCOD?
Thyroid problem is different. Patient may have both, but thyroid problem should be treated. First should be treated.
I mean, it's not related to will not have any impact on PCOD.
No.
We have, ma'am, so like we are some more or less you have covered the questions. Many of them are similar questions which are coming from the students. Like we would like to thank you for spending your time with us and sharing this valuable information for our students. Ma'am, we would like to requesting our principal sir, Dr. V. Alagarsamy sir, to present the memento to our speaker as a token of our gratitude. Sir.
Yes. Madam, due to some meeting, sir is left the meeting, madam. So anyway, thank you, sir, Dr. Sabira, madam, for giving that insight to that PCOD lifestyle modification in Sexual and Reproductive Health Awareness Day. So definitely that will be helpful for our students and those who are watching these programs. So on behalf of our chairman, sir, Sri Amman Raju Garu, and our vice chairman, Sri Ravivarma Mantena Garu, and our principal, Dr. V. Alagarsamy, sir, and all our staff members and students, I'm requesting you to accept this virtual momentum, madam.
Thank you so much.
Yes. Thank you, madam, for spending your valuable time with us in this auspicious day.
I'm very grateful to all of you. Thank you so much for making me this part of this event. Thank you.
Yes,
thank you, ma'am. Sir, can we move on to the next session then?
Yes, madam, you can move.
Dr. Shravani has come in.
Yeah.
Good afternoon, ma'am.
Good afternoon.
Ma'am, shall we begin the session?
Fine. 2 minutes.
Yeah, sure, ma'am, sure.
Yeah. Like my internet connection was poor. I'm logging in with my colleague's ID. Just 2 minutes.
Okay.
Yes, I'm ready, ma'am.
You're ready, ma'am? Okay, ma'am. So now we will start with our second session for the day to create awareness on menstrual hygiene by Dr. Stravani. So now I invite Raviteja sir, Assistant Professor at Emena College of Pharmacy, to please introduce our speaker, Dr. Stravani.
Good afternoon, ma'am. It's my pleasure to introduce Dr. M. Shravani, graduated from Rajiv Gandhi Institute of Medical Sciences, Srikakulam. And currently, Madam is pursuing postgraduate DMB from Felmcare Hospitals, Hyderabad. And Madam submitted her thesis on evaluation of female urinary inconsistency, and her area of interest, endoscopic surgery and surgical oncology. And now in this session, we are going to have a talk on menstruation and its hygiene and a few of the lifestyle modifications. With this brief introduction, I graciously invite Dr. M. Shravani Madam to share her thoughts. Please welcome, ma'am.
Thank you, Raviteja sir, for welcoming me. Firstly, I want to thank all the persons here who are here for inviting us. Thank you so much. Good afternoon, one and all.
Thank you, ma'am. Good afternoon, ma'am. Ma'am, you can share your screen.
Yeah. Because good afternoon, one and all. I'm going to discuss about menstrual hygiene. Firstly, this is the most important topic we have to discuss about, but least discussed. So today I want to educate everyone about periods. Okay. And this is the thing that it is the most important issue at the least talked about. Actually, why we need to talk about periods? Every woman in the world deals with the monthly menstrual cycles. However, the need for hygiene is met with silence and neglect even today. And dear girls, menstruation is not at all a problem, but poor menstrual hygiene is definitely a problem if you are not taking care of your menstrual hygiene correctly. And why do we need to destigmatize menstruation? Means, firstly, what is stigma? What is the stigma behind menstruation? Maybe we are very fearful of periods. Maybe we feel ashamed of periods, or maybe we feel embarrassed of periods. Girls, please don't be embarrassed of periods. That is a normal thing. That is absolutely a normal thing a girl can have. And half of the world is having women and half of the world is menstruating. So it's absolutely a normal thing. So we have to destigmatize. So we have to make women comfortable to talk about these periods normally. So this is to discuss to end the shame and suffering that women are facing every day regarding periods, to not sacrifice a girl's education and career choices, because during periods, what they'll say, don't go to school, don't go here, don't go there. It should be stopped, and to generate awareness about menstrual hygiene. So half of the world is menstruating. So let's start the conversation about periods. This is my most favorite slide, happy to bleed. Actually, I can say, please be happy and proud to bleed, because you are bleeding regularly means your ovaries are functioning normally. Your reproductive system is absolutely normal. So you should be happy to bleed, and you should be proud to bleed, that if you are bleeding normally, you can give life to another life. And regarding the introduction, what is menstruation? Girls typically menstruate between the ages 10 and 19 years, and menstruation continues until they reach menopause. Menopause usually occurs between 40s and mid 50s. So from 10 to 19 years in between, and to 40s and mid 50s, women will bleed. And the menstrual cycle is usually around 28 cycles, 28 days. And the 28 days is not in every woman. Like for some, it can be 21 days. If that is regular, that is also normal. If that is 35 days, that is also normal. So, but it can be varied from 21 to 35 days. And the duration of bleeding is 2 to 7 days. Rather than bleeding, what are the symptoms or sufferings you will suffer during periods? Those are menstrual cramps, breast tenderness, bloating, mood swings, irritability, headache, tiredness, and low backache. There is other syndrome called premenstrual syndrome. If you are having those symptoms more severely, we can call it as premenstrual syndrome. Those symptoms are bloating in abdomen, breast swelling, pain or tenderness, mood changes, headache, weight gain, changes in sexual desire, food cravings, and trouble sleeping. So girls, menstruation hygiene matters. So I want to talk about how to take care of yourself during menstruation. Firstly, what are the menstrual hygiene products we are using nowadays? Are use and throw sanitary pads, homemade napkins or clothes, tampons, and menstrual cups. Firstly, sanitary pads versus cloth. Sanitary pads means what we are buying in shops, and cloth means we are using from homemade clothes. So compared to cloth, I'll ask you to prefer sanitary napkins or pads, because they are much easier to use and dispose. And with pads, you'll have decreased chance of infections. Sanitary napkins has absorbent material, so you'll have a dry feeling for more hours. And you can easily mobile on that time. So it helps in mobility and ease of daily routine work. Using cloth is also absolutely okay, but be ensure that cloth is soft, dry, and absorbent cloth. And if it is being reused, it must be washed thoroughly and dried in a sunny place. Someone, can you please mute off? Okay.
Yes, ma'am, it's mute now.
Yes, thank you. It should be stored in a clean and dry place. Do not share the cloth with anyone. And after multiple use, dispose of this cloth. And other things are tampons. A tampon is nothing but a technically designed tube of cotton that should be inserted in vagina to absorb menstrual blood. And recent things are menstrual cups. Why menstrual cups have evaluated is every girl is menstruating every month, and they are throwing pads into the environment. Like the disposal of pads become a major problem nowadays. So menstrual cups have evaluated. These are flexible dome-shaped cups that you can wear inside your vagina. The cup is made from medical grade silicone or latex, and it collects the blood instead of absorbing. So whenever it collects the blood after 2 to 4 hours, you can take out the cup, you can clean the cup and reinsert it again. So best known brand is V Cup. Compared to other women's hygiene products, these are harmless and reusable products. But these are better to use in who are already mothers like who are multiparous, not unmarried girls. The advantages of menstrual cups are no wastage, so eco-friendly. There is nothing like disposing or everything. No worry to change frequently, and no vaginal dryness with these cups. This is the picture of menstrual cups. Like these uses of these cups is increasing nowadays. And how to manage your menstruation? Like always use a clean sanitary pad. Never insert any cloth or pad material that is inside the vagina. Change the pad regularly, like every 6 to 8 hourly based on the blood flow. If you are having heavy flow, please change frequently. Do not keep till pad is completely soaked, and use clean water after using pads to wash your hands. Actually, the government and WHO, everyone is wanting the society to know more about menstruation and menstrual hygiene. So they gave one day to menstrual hygiene, that is 28th May, they gave it as menstrual hygiene day. So they gave some things we have to follow, that is change sanitary napkin every 4 to 6 hours, wash your undergarments properly, keep yourself clean, discard used sanitary napkins properly, wear clean and dry undergarments. And after using, how to dispose of the pads. Please don't throw them into toilets, particularly in the water closet. Just wrap it in a clean paper to make it a package and put it in the bin so it can be burned or buried later. And how to keep yourself clean during your periods. Every day, morning and evening during your periods, wash with soap and water, pad the area, dry with a cloth and use a fresh pad. Never douche. Douching is different and cleaning is different, girls. Cleaning is nothing but just cleaning. Douching is washing out the vagina, like flushing out the vagina with water. Don't douche. And why we have to follow proper menstrual hygiene? What are the risks if you don't follow proper hygiene? The potential health risks due to poor menstrual hygiene are unclean sanitary pads or materials. They may cause local infection, which can travel up the vagina and enter the uterine cavity. If you are not changing pads frequently, those wet pads may cause skin irritation. Skin irritation may cause breakage of skin and then infection. And insertion of unclean material into vagina. Bacteria will have access into cervix and thereby uterine cavity. And unprotected sex during menstruation. There is possible increased risk of sexually transmitted infections and transmission of hepatitis B if you're having sex during menstruation. Unsafe disposal of used sanitary pads. If you're not disposing them safely, then there is risk of infecting others, especially with hepatitis B and HIV. Frequent douching. Because of frequent flushing of vagina with water, it can facilitate introduction of bacteria into uterine cavity. So lack of hand washing after changing a pad. It can also spread infections. This is the menstrual hygiene you have to follow. And I want to discuss something more about menstruation. What are the signs of problem with your menstrual cycle? Normally, what I'm going to say is 28 days is a regular cycle. But if you're having 35 days regularly, like every 35 days you are getting periods, that is also normal. If you're getting 28 days, that is also normal. If you're getting 45 days regularly periods, like after 45 days you are getting period, again after 45 days you are getting period, that is also absolutely normal. Okay. And what are the signs of problems if you're having delayed periods or entirely stopped periods, irregular periods, bleeding more than 7 days, period interval more than 35 days or less than 21 days, or if you're bleeding in between the periods, that is also an issue. I'll advise every girl to follow menstrual calendar. Just use one calendar every month when you start bleeding and when your bleeding is stopped, how many pads you are using, whether it is regular or irregular, you'll come to know. Please use a menstrual calendar, that will help you so much. And some will have menstrual cramps. What you have to do if you are having menstrual cramps, that what you have to do when you are having periods pain. If pain is mild, you can increase exercise. Normally what people will say, don't exercise, take rest. So no, it's not the issue. Please increase your exercise, like do more activity, meditate, eat fresh vegetables, fruits, nuts and whole grains. Avoid coffee, red meat, sugars, milk and fatty foods. Drink plenty of water. If not relieved, you can use any antispasmodic tablet every 8th hourly. If still the pain is persisting, like without those activities and with those activities or with those medication also, your pain is not controlling, or it is hampering your regular activity or lasting for more time, please consult your gynecologist. And what are the taboos? Like what are the myths we are seeing day by day because of periods? Like many will think like, I can't attend a religious function. I have to sleep separately from others. I can't play sports. I can't attend school. Please stop this nonsense. And the myths about periods and facts about periods. The myth is everyone will say that sanitary pads should be kept private and should be covered in paper when purchasing. Nothing to hide, girls. Believe me, buying sanitary pads is like buying soap and toothpaste only. They are all hygienic products, personal hygienic products. That's it. Nothing to hide. And whenever you're having menstrual cramps, your grandmother will say, take rest, take good rest. But no, tell your grandma that exercise will help in relieving the cramps. What are the myths? Other myths we are facing? Many will say you can't get pregnant during periods, but chances are very less. You can become pregnant during periods also, with having periods also. And you should avoid activities like exercise and sex when you are on your period. So it's absolutely wrong. Exercise will help to relieve cramps, and your period should last exactly 1 week each month. No, it depends on every individual's body. It's not 1 week, like 2 days, 3 days. It's not like that. Your body is unique, and so is your monthly cycle. There is one best way to deal with period blood. So it's not like that. There are many ways, and choose what is best for you. Like what is working best for you, you will know. That's it. The last thing I want to say is periods are nothing to hide. Together we can end period stigma. No more limits. So please go to colleges and schools regularly. Create awareness among your sisters, your mothers, and girls whom you are meeting with. Tell them about what you know about periods. Thank you so much.
Thank you, ma'am. Ma'am, thank you for giving a session where like you have spoken about the stigma and that statement, happy to bleed, that was very inspiring. That is very true that there is a lot of taboo stigma associated with talking about menstrual cycle in public, and this platform has given us a way to express. Yes, that it's not something to hide, but we can talk freely about it. Thank you so much for enlightening us on the topic. So, ma'am, you can stop the screen sharing.
Yeah.
Now the session is open for queries. If any questions are there from the students, we can, or from any of the participants, you can please post your questions in the chat box. Otherwise, you can raise your hand. So, ma'am, here we have one question here about the use of tampons and V-cups. So here the question is whether it will cause any infection, fear of infection, because that is the question about.
No, as far as you are maintaining good hygiene, nothing will cause infection. Like you have to know when to change the pad, when to change the tampon, or when to clean the cup. You have to know, that's it. But menstrual cups are mainly for married women, not for unmarried. Okay.
Thank you, ma'am. And there's one more question about this advert. We wash, some advertisements are there about out liquids like we wash. So is it advisable to use those?
No,
Such?
actually, I'll say no because our
Am I
vagina.
audible?
Yes, you're audible. Our vagina will have natural flora, bacterial flora, which will help in normal secretions. With V-washes and everything, that flora will go away and we'll have chance of more infections. So without any consultation, don't use anything. Take a proper consultation from doctor and then you can use.
Okay, ma'am. And one more question which we have here from the participants. If the bleeding is coming, health issues.
I didn't get your question. Can you repeat?
If the menstrual bleeding is for coming in, should there be any suspecting of any health problems?
I didn't get.
Yeah.
I didn't get your question. Can you repeat?
Yeah, the question is if we are expecting like menstruation should be around 5 days or 6 days, but if it is coming around 10 to 12 days, once it starts,
yes, that is absolutely normal, absolutely abnormal. Like it should be 2 to 7 days. That's it. Within 7 days is normal and it shouldn't be heavy. That should be moderate flow. Like wetting 6 to 7 pads or 8 pads daily is also not normal. The flow shouldn't be heavy. Like 3 to 4 pads per day is okay. More than that, 6 to 7 pads having more clots or bleeding for more than 7 days is not normal.
Thank you, ma'am. And one more question here. How to cope up with weakness during menstruation?
They have to take good food. I said no already. They have to eat fresh vegetables. They should eat more water. They should take whole grains, nuts, and everything.
Ma'am, one more question in the here. It is does diabetes have any relationship with irregular periods?
Actually, no.
No.
It's not diabetes. It's with irregular periods, patient and PCOS, maybe persons will have insulin resistance. That is like because of irregular periods, patient may have insulin resistance, but not vice versa. Like diabetics can have irregular periods. It's not true.
Okay, ma'am. Thank you.
Ma'am, one more question. How to overcome cramps during menstruation?
I already told no. If it is mild cramps, they can meditate, exercise. They should take plenty of water, eat good food. If it is not controlling with normal measures, they can take antispasmodics like menthol spas. Any tablets they can take. If that pain is hampering their activity, it's not subsiding in 2 or 3 days. They have to consult the gynecologist. One question from Rupini. After menopause, can women get their periods like after a gap of 1 year or so? It can happen, but it has to be evaluated, Rupini. It can be normal also because of everything will be atrophied after menopause. Like after menopause, their uterus will be atrophied, vagina will be atrophied. That can be normal or abnormal, but they should consult a doctor and they should get proper evaluation done. It can be due to atrophy also, they can bleed, or otherwise it can be cancer also. So they should be evaluated properly.
Thank you, ma'am. Ma'am, one more question. Is it normal to have periods twice in a month?
Like based on their cycle, if they are having 21 days cycle, for suppose the patient got periods on first of the month, and again she got on 23rd. like the gap is 21 days and above. Again, she's getting after 21 days. That is absolutely normal. Though that is twice a month, the gap is 21 days every month. So that is normal. It's not like if the gap is 15 days or less than 15 days, that is not normal. That should be regular, like every month after 21 days or every month after 30 days. It should be like that.
Okay, ma'am. Ma'am, one more question is again about relationship between the absence of periods and weight gain. Like the person has actually having irregular periods and at the simultaneously having a weight gain. So they have asked whether it is related. Is it because of?
Yes, it is related because that PCOS or irregular periods and weight gain go hand in hand. Like with weight gain, that periods irregularity will increase. With irregular periods, the obesity will increase.
Thank you, ma'am. We have similar questions coming up. So like we'll collate all the questions or we'll get back, email you or something for from different students, their queries together we'll send to you. Thank you so much, ma'am, for your time and for making us aware about menstrual health and how to manage, how to maintain a good health, menstrual health and hygiene. Right now we have our principal sir, Dr. V. Alagasamy sir is there with us to, sir, can you please conclude the session?
Okay, madam. So thank you, Dr. Sravani, for your valuable speech, and our students must have enjoyed the session, and hope all these points which are given helpful for the not only to our students but also for the society. So our students will make use of this knowledge when they go for the that is community pharmacy activities when they go. So thanks for your valuable time spending with us. So on behalf of the management and all students and faculty members, we thank Dr. Sravani for accepting our invitation and delivering this wonderful speech. Kindly accept this memento as a token of our appreciation for your valuable presentation, madam.
Thank you so much, sir. Thanks for calling us first. Thanks for inviting us. It's a great pleasure for us to be here, to be a part of this webinar.
Okay, madam. Thank you. Thanks a lot.
So much, sir.
Okay. So I
Thank
think
you to Dr. Sravani and Dr. Sabira. Sir, can we conclude the session?
Yes, madam.
Close. Okay. Thank you, sir. Thank you, ma'am.
Thank you so much.
Jayaprakash sir, you can end the meeting, sir.